Hello everyone, and welcome to this live Q&A from the sidelines of the World Health Assembly in Geneva, Switzerland. The World Health Assembly is an annual decision-making meeting where we have our member states, so countries from all over the world who join us, as well as all the global health stakeholders who are here to discuss the important public health agenda for the year ahead. And at the sidelines of this very, very important meeting, we're speaking about cholera, which is currently a global emergency. So with me today is Dr. Philippe Barbosa, who is WHO's lead on cholera, and I am Shagun Khare. I'm with the Department of Communications, and I'll be asking your questions and my questions to Philippe about cholera today. If you're joining us on Twitter, then you can tweet your questions to us with the hashtag AskWHO, that's ASKWHO. And if you're joining us on Facebook or LinkedIn, you can drop your questions into the comment section and we'll try and get to them as soon as we can. So Philippe, perhaps a good place to start is, what is cholera? What is this disease?
Cholera, it's a very old disease. It's a diarrheal disease transmitted, caused by a bacteria, Vibrio cholerae, and transmitted by water and or food that has been contaminated by the Vibrio and therefore by stool, feces.
So it's a disease that spreads by a bacteria. And the way that it spreads is through contamination, right? Contamination of?
Contamination of the water or the food. Vegetables or other type of food that have been contaminated by the bacteria.
Yeah, so it's through feces primarily,
feces.
Right? If somebody is infected, their feces can contaminate other things.
Absolutely. So it's a bacteria that does not really stay long in the environment. So there is always a human source through its stool, its feces, beyond the contamination. So that's where the access to water and sanitation is so important to prevent this disease.
Right. So we'll get to that in a bit. But maybe my next question would be, cholera is such an old disease. We've been hearing about it maybe even centuries. Is it a problem today? Where is it a problem? Who is at risk?
So it's a very old disease, as you said. I mean, it has been there for hundreds, if not 1,000 years. And we are today at the 7th pandemic. So it's an old disease. Do we have a bigger problem now? The answer is yes. There are more and more countries that are being affected. And who is affected is the poorest part of the population of the poorest country in the world. So cholera is a marker, it's a visible marker of inequity and poverty.
So where there is poverty and inequity, you're more likely to have cholera?
Absolutely. The rich country where the access to water and sanitation is good have very small risk of having cholera outbreak. They can have a few cases, but no outbreak. The poor country where access to safe water is still an issue, where people have no access to sanitation, they are the ones who are at risk.
They're the ones at risk. Thank you, Philippe. So this is going to be a bit of an interactive question and answers, because as you can see behind us, we have a few things to show you. And maybe we will start with this bed right here, Philippe. So what is this bed and why is there a hole in the middle of it?
So this is what is most often shocking the people when they go to a cholera treatment center for the first time. This is a type of bed that were developed specifically for cholera. As I mentioned, cholera is an acute watery diarrheal disease. Patients, severe cases, are losing liters and liters of stool in a day, and also they vomit. So this is why there is a hole in the bed for the patient to be able to lose his stool directly in the bucket.
So patients are so, is it that they need to go to the toilet that frequently, or they're so weak that they cannot go to the toilet? What is it?
It's all together. It's the volume of stool, it's the frequency, and they are extremely weak and they don't have the time. So this is really also an illustration. People are shocked by that, but this is a reality of severe cholera patients.
Right. And just to give people a bit of perspective, what percentage of patients will end up needing cholera treatment in a center with a bed like this?
So from the people that get infected by the bacteria, 20% will develop the disease, okay, at different stage. And according to the situation, between 20 and 50% will have to go to a severe cholera treatment center.
Okay.
So that really depends also of other factor of response before.
Right, right. And possibly how healthy the patient was before,
Absolutely.
etc. Okay.
If they had access to other healthcare before reaching the center,
right,
etc.
Right. And Philippe, what is this in your hand?
So this is a drip. So as I mentioned, patients are losing a lot of water and vomit. So it's water, but it's not just water, it's a salt, so a mineral salt that is in water. So rehydration is extremely important. On average, a patient, and this is just the average, will receive 8 liters for rehydration. It can be much more, just an average.
Wow.
So this is just to illustrate the quantity of both stool and vomiting that the patient are losing.
What So is it, I've heard you say that dehydration is the biggest danger in cholera, right? What is it that if somebody has to die of cholera, what is it that will kill them?
It's the dehydration and the effect of the dehydration. People are losing water, mineral salt. They can lose it, having diarrhea and vomiting at the same time, and then after you have what you can call a volemic shock, and the organs stop to function.
Wow.
Just because there is no more fuel, there is no water, there is no mineral salt.
Wow.
So this is why the rehydration, by other mechanism, but also by IV fluid, is so important. Basically, what we need to do is to refill what the people have lost due to the disease.
Right. And this is not something that is particularly advanced or sophisticated, right? I imagine every country in the world has access to this?
Absolutely. I mean, this is very basic, typical thing that you should find in all hospital and dispensary. Infusion are used for many other things. Most of the patients, that go to the hospital will get an infusion at some stage. So this is something which should be available. One of the issues with cholera is, as I mentioned, is the quantity that is required for each patient. Okay, so when you have an increase in number of cases, this supply can very quickly be used because of the quantity that is required to treat a single patient.
Right. We have a question on Facebook from a viewer called Jay Kumar, who's asking the difference between cholera and malaria. Can you speak a bit about that?
So it's very, very, very different. Malaria, it's a parasite. It's transmitted by mosquito, and the treatment is through tablet that you take orally. Cholera is a bacteria which is found in patient and in the environment, and it's a diarrheal disease. So the symptoms are very different. Normally with cholera you don't have fever. With malaria you have a lot of fever. So it's usually not disease that gets where there is a confusion in diagnosis. The clinical presentation is very, very, very different.
Okay. Thank you. The same viewer has a follow-up question around what does it take to prevent or avoid cholera?
So in theory it's extremely simple. Just to provide safe water and good sanitation. That means latrine and way to treat the used water. This is what is needed to prevent cholera.
Right.
So we know this is simple, but this is not a reality in most of the countries in the world. So there are some other mechanisms. Vaccination. We have a vaccine that provides, due to the disease, not the vaccine, a short-term 3 years immunity. So that's provide also. That's a way also to prevent. But the long-term prevention is by just giving clean water to people.
Right.
and good sanitation.
Right. Since you mentioned vaccines, maybe this is a good time to speak about a very surprising decision that was made last year in October. Can you tell us what that decision was?
So in October last year, the International Coordination Group on Vaccine, which is the institution that manages the emergency stockpile of cholera vaccine and other vaccine, had to decide for the first time ever to suspend temporarily the second dose. Normally, with cholera, you need 2 doses of vaccine to sustain immunity for 3 years. But because the number of outbreaks last year, there was not enough vaccine to maintain the 2 doses regimen.
Right.
So ICG, the coordination group, had to take the decision to move to 1 dose strategy to be able to vaccinate more people, but
Right.
for a shorter period.
So there is such a large amount of cholera going around in the world right now that we've essentially run out of vaccines, right? We're not using them preventatively, and even to respond to outbreaks, we're doing what's called dose sparing. So instead of using the full doses, we're using just 1 dose. Maybe this is a good time to move to this model that we have here. This is a model of a cholera treatment center, and it's something that's set up when there's a large outbreak, right, Philippe? And at the moment, as you heard, there are many large outbreaks going on in the world. So we have a question from a LinkedIn viewer called Denise asking, why is cholera on the rise?
So why is cholera on the rise? So there are multiple factors. Okay, so cholera is still endemic in a number of countries because people do not have access to clean water, safe water, and sanitation. But what is very new is the pandemic of COVID has had an impact in sucking out the resources available in a limited resource country. So that's one of the factors. And the second, which is the more concerning, is there is an additional effect played by climate change, the impact of climate change. Most of the the large outbreaks that we have seen last year and this year have a direct link to a major climatic event, be it a drought, a flood, cyclones. But so this is really the characteristic of an amplification of the existing already concerning situation by climate change.
Right. So climate change, you mentioned COVID-19, and in general poverty is a big contributing factor to cholera.
War, displacement of people, insecurity,
And these are, in general, we're seeing a rise in all of these factors, and also therefore a rise in cholera. So Philippe, why don't we speak a little bit about this cholera treatment center? How does it work?
So one of the characteristics of the epidemic of cholera is that the number of cases can increase very rapidly and very sharply. Okay, so very often, most of the time, in the course of an outbreak, the regular healthcare facilities are overwhelmed. However, it's very easy and relatively cheap to set up specific cholera treatment centers. They are made of tents, so easy to set up, easy to dismantle. What is very important is the setting of these camps to prevent any infection within the camp, within the treatment center, but also from people coming in and out of the treatment center.
Right. And so here we're seeing different zones marked for different things, right? So can you tell us maybe what each of the zones is?
So that's a typical example. So this is the main entrance where all the patients will enter. So at the first you have a triage where people will be medically examined to see if they meet the case definition. They will be placed on observation, and you can see that everywhere there are some water stations where people can have access to safe water, but also some latrine. When the patient have been observed, get the first treatment, then they will be moved to the biggest part where the patient are taken care of. Okay, so there you have the latrine, the showers, the tents, again water station, place for people to wash their clothes. Okay. So that's during the acute phase. When people are getting better, they go to the observation phase again, but for recovery, and then they exit when they are cured.
Okay, so maybe this is a good time to ask a question that we've received from a few viewers, which is cholera contagious or is it transmittable? I mean, we have this separation because I can answer this one. It is contagious if the feces of somebody who's infected with cholera infects the water around them. So that's why it's really important to make sure that patients with cholera are separated. Anything to add to that?
No, exactly. I mean, there is a limited human-to-human transmission. It's not a disease like Ebola or other the mode of transmission. However, it's transmitted by dirty hand, by clothes that have been contaminated by stool and vomitus, etc., etc. So that's why the infection prevention of control in the treatment center is important to prevent taking the disease out of the things. But again, the main message is safe water. If people have access to safe water, then the risk will be much lower.
Thank you. So Philippe, you mentioned infection prevention and control. That is one of the ways WHO supports countries in responding to cholera. What are some of the ways that WHO would help with this treatment center? Could you just explain to our viewers how we respond to outbreaks?
So, in many ways, one of the easiest ways is WHO will provide what we call cholera kit, and there are different type of kits. Some of them will contain all the elements to set part or all of a treatment center, including tents, buckets, cholera beds, medical drugs, IV fluid, etc., etc. So that's one of the first and I would say most visible part of the things. But WHO also supports the establishment, the training of the staff, the monitoring, the making sure that the infection prevention and control is established, and also other parts, the surveillance of the disease, but also vaccination when there is a vaccination ongoing. So the response of WHO to cholera outbreak is multifactorial and of course provides a lot of things for treatment, but also to prevent patients to be infected, people to be infected.
Right. We have a question from a viewer called Karina who's asking how many patients can be treated on average in such a center?
So that depends from the settings. So we have what we call, treatment center or treatment unit. Okay, so it's modular. According to the situation, it can be you can set up a treatment unit for 10 patients, but you can have a treatment center for 200, 400 patients.
Okay.
So after, what will depend, it's the staff that have a specific dedicated area and the number of tents.
Okay, and at the moment we have helped set up these treatment centers. Where are some of the bigger centers? Can you give us some examples, maybe of countries?
But there are currently 25 countries that are reporting cases, which is already a big increase compared to last year, which was again a very bad year. Last year at this period we had only 15 countries that reported cholera outbreak at this period of the year. So in most of these 25 countries you have this kind of settings. Okay, so
right.
Malawi and Mozambique were places in the past few months. Now the situation has drastically improved, but the countries that are affected have this kind of settings everywhere.
Okay. The same viewer had a very interesting question on the topic we touched on earlier, which is vaccines. So the question is, what portion of the at-risk population has access to the single dose of the vaccine? So we've reduced how many vaccines we can give out. How many people are we able to reach? Do you have a sense? I know it's not an easy question, but an interesting one.
The answer, or the number of vaccines that will be available for the whole of 23, so this year, is 35 million. Mm-hmm. Plus minus 1 million. So that's a number of people that we will be able to vaccinate at the maximum. 35
with
million
the partial dose, right? With one dose.
With only one dose.
And so we have 35 million doses available for the year.
For the whole world.
How many people does WHO think are at risk? maybe directly at risk because they're in outbreak situations, or broadly?
At risk, a very rough estimate is 1 billion people.
1 billion people?
1 billion people.
Wow. And that's across how many countries?
That's taking as a basis 20 countries with acute and evolving outbreak, another 10 countries with ongoing outbreak, and just for the at-risk, the directly neighboring country. So the countries that are really sharing a border with an affected country.
Right. We have a question, an interesting one again. I'm missing the name of the viewer, but the question is about refugee camps. So what are the steps that we're taking to provide drinking water and better sanitation in refugee camps? But maybe we can speak a little about displacement and cholera.
Yes, because the issue is displacement. It's not just refugee camp, it will be the same with internally displaced population. Mm-hmm. This is a risk factor in itself. You have a higher concentration of people in a very small place with, especially at the beginning, more challenge to have access to safe water and enough infrastructure for sanitation. So mass population movement, refugee camp or IDPs, internally displaced people, are more at risk. But that is only if you have a cholera outbreak already ongoing.
Right.
So refugee camp does not mean cholera outbreak.
No.
So that's what is important to bear in mind. In places where there is cholera outbreak, refugee and IDP will be treated exactly as the rest of the population. There will be no difference in terms of accessibility to the vaccine or water and sanitation.
Right. It's a big and complex problem, as you see. Of course, bacteria, viruses know no borders. So refugees, others, everybody's affected alike. But of course, the conditions in refugee camps can sometimes be more challenging. Maybe this is a good time to talk a little bit about solutions. Just right here, what are we looking at here?
So here, this is a part of the solution, and this is a model of what you have seen on the map here on the sketch. Access to safe water, soap for people to be able to wash their hands. This is what billions of people in the world are still lacking. They do not have access to water which is safe to drink, and this is a key. A long-term solution for cholera is access to safe water and the treatment of this water so that they are not going to contaminate it other neighbors or sources. So that's the sanitation part. So this is feasible.
Yeah, this doesn't look very complex, does it?
No.
I see soap and water.
No, and in many countries where cholera outbreaks are occurring, why you say to people, wash your hands with soap. They don't have the resources to buy that. This is what we are talking about, people that are poor enough not to be able to buy soap. So this is nothing about rocket science and building big hospital, just providing safe water, soap, and latrine and sanitation for people to be able to go and do what they have to do. In many countries, in many places, people have to defecate in open place. This is a disgrace for the people. It's very it's affecting them. It's a question of human rights as well. So, and this is simple.
Right. So the ultimate solution, which is clean water and sanitation, is well, it seems simple, but of course many people don't have access to this very, very simple basic necessity. We had a question on how to treat a cholera patient if he or she is away from the hospital. And here we have a few things, so maybe they can come in handy, Philippe.
The first thing, and the big revolution in cholera treatment is this little bag. It's called ORS, oral rehydration salts. that costs a few cents. You dilute that in clean water. Again, the issue is having safe water. And that will prevent many, many deaths. Okay, so at least that will allow, even for severe cases, to go to a place where they can have infusion sets. This is very cheap. People are still dying because they do not have access to that. Just a few cents. It can be made with salt and sugar, and again, safe water, if it's not accessible. But really, the treatment is simple, very simple. For more severe cases, you need the drip, the IV fluid, antibiotics, and for children, zinc, but that's it. That's it.
So it's really so simple that absolutely no one should be dying of cholera today.
No respirator, no ICU, no big hospital, no whatever. I mean, you need trained medical staff. And it's very simple, easily accessible, cheap treatment.
Thank you, Philippe. So if everything is